Population health, that's really the state of the health of our population here in Northumberland, and that can be different across our communities. Population health management is basically the method that we are going to use, or which we can use, to start to address issues around health inequalities. It's recognising that whilst access to healthcare is really important and the number of hospital beds is really important, actually a lot of health conditions are linked to lifestyle and also linked to the environment that people live in. So that the environment where people are born into, they live in and they work in. And those issues, actually, those factors can have a massive impact on people's health. So for instance, an individual with diabetes who's struggling to manage their diabetes and weight, not managing to get exercise, but actually there's broader issues at play. That individual may have financial problems because of job insecurity, they may be living in poor housing, they may have relationship difficulties or mental health problems. And really what is population health management trying to achieve? It's actually stepping back and saying, actually, you're a whole human being, and before we, as well as giving you your medication for your diabetes, what we really do need to do is actually address some of these other issues, actually give you some support on your finances, or your housing, or relationship counselling, or mental health guidance, or counselling. Because really, until we actually address the whole person, we're really probably just scratching the surface, and we're not going to bridge this inequalities gap in Northumberland if we don't seriously take these issues to heart and manage them. So population health management, or population health, really the way to achieve that is just to continue on our integration journey. So we've made lots of forward strides, massive strides in terms of managing or integrating health and social care. The next step is really integrating that work alongside public health and alongside our communities, and really doing something, helping and supporting our communities to aspire to improve their health, and they need to do that together with our support. One idea in Northumberland is to create a Northumberland Academy, where we can actually, almost like a training centre, where professionals and volunteers and members of the community can come together, learn together, break down those language barriers that exist, because I think a lot of professionals use a lot of jargon that people don't understand, but also a place where actually there is a real joint ownership of the problem and working a solution together in a genuine way, rather than being told by the statutory organisations. And really key to that's going to be our support from our local government and wider government, because the legislation has to support this integration and this working, but also it impacts on housing, employment, green spaces, transport, all these other areas which as a county we can have some influence over, but we really need support at a national level also. So I hope that's been clear and that explains what we're about.